All right. So again, good afternoon to everybody, and thank you for joining us for ACC's Appalachian Child and Family Health Data Dashboard Training. We're super excited that we've gotten this project off the ground. For those of you that don't know me, I'm Elizabeth Jones. I'm the Senior Director of Operations and Advancement for the coalition. And Daniel Klopfer, who is our Director of Assessment and Evaluation, will actually be leading the seminar, and he has really been the one who has spearheaded this project from day one. So he is much more versed in it than I am. So again, if you're just entering and you haven't done so, we just ask if you could put your name, where you work, and the county you're in the chat. I'll also be monitoring the chat for any questions that come up, and there is time at the end for some Q&A for everybody. So with that, Daniel, are you ready to go?
Yep, thank you, Elizabeth. So moving forward, I just plan to just share my screen of the website and just walk everybody through. So I'm just going to go ahead and do that now. Give me one moment, please. Okay, is it everyone seeing the website? Great, yeah. Thank you. So like Elizabeth mentioned, my name is Daniel Klopfer. I am the Director of Evaluation and Assessment with the ACC. Thank you all for joining this webinar demonstration today. And like Elizabeth has mentioned, if you could, please go ahead and put your name, county, where you work. And then as we go through this, if you've thought about it yet, or as we go through this and you're thinking about it, if you could put one or two things or ways you imagine using this site, this resource in your work, that'd be really helpful for us to help maybe update and manage this site moving forward, depending on the way people decide to utilize the site or are anticipating use of the site. But like I said, obviously this is a new resource. You may not know quite what's here. So as the hour or the half hour progresses, just go ahead and just jot a few things down in that chat of ways you may anticipate using the site. And then, like Elizabeth mentioned, we'll have someone monitoring the chat. So if you have questions throughout, just please put them right there in the chat. We'll either answer them directly in the chat, or again, like Elizabeth mentioned, we'll have a question and answer session at the end where we can all come together and discuss questions that arise. I did put the website URL in the chat. So if you'd like to follow along with this demonstration. But one thing to note, just a few days ago, Conduent Healthy Communities Institute, the organization that the agency that is managing and helping us build this site, who we contracted with, they put out a notice saying that if you cannot get the site to actually type in HTTPS the 2 backslashes, it's just for initial security for the site. So if you or someone you know is having issues with the site loading, just go ahead and type in the whole entire URL, including the HTTPS there in the beginning of the www.
And Daniel, I don't know if it's just me, but like your screen's really big, and maybe that's what you're wanting to do right now. So I'm not seeing like your whole screen, but I don't know if that's just me because I'm only looking at it on my laptop.
Okay. Do you see like top of the website essentially? What's the lowest portion do you see? Do you see define data?
No, well, you just scrolled down to it, so I see it, but I wasn't seeing it before.
I didn't scroll. Actually, I didn't scroll anything. But so what is it? Do you see now?
Let me see. Maybe there. Maybe it was my computer. Okay.
I see the whole thing. Daniel, I see a regular screen, so it might be per screen. I don't know.
Okay. No, okay. I got it now.
So I did zoom in my screen just to make it easier for folks to see the text. So if there is issues with the screen, please let me know. I'm just trying to make it as easily readable as possible for everyone to follow along. So for this dashboard, like I mentioned, we contracted with Conduent Healthy Communities Institute. which is an organization that builds dashboards all over the place for a variety of agencies. We have a representative from Conduit on our call today for any additional help that we may need. So thank you and welcome, Kara. The main purpose that we decided, the ACC decided to build this website and provide this resource was essentially to make social determinants of health data indicators widely available and easily accessible for the Appalachian region, for those folks working in the region, who want to advocate for the region, to use, and also to highlight the needs of the area. Some things to talk about before I kind of get working on the site. The site contains over 200 social determinants of health indicators. I think it's 220 to be exact at the moment, with I believe 24 sources of data included. And so as you see, there's a wide range of data included in here. And so bringing it all in this one site was really one of the main reasons we wanted to do this. Bring all of that data across the web here in one location. Conduit manages the majority of the data on the back end, and will update the data on a yearly, biannual basis, depending on when the data itself is updated, when the sourced data is updated. We also have been able to build a regional location for us to look at, so we can combine all 32 counties into one location for a regional view of what's going on. And we have data for the 32 individual Appalachian counties. And then for some of the data, for some of the indicators, we can drill down even further into zip code and census tract. We have the ability in this site to compare to the state, to other state counties in general, to the US and US counties, again, when the data is available, depending on the source of the data. One last note that I want to mention before I get started, we are able to add our own local data to this site. In addition to the data that is managed by Conduit, we're able to add our own data. For example, we have already added some Ohio Medicaid Assessment Survey data related to children in the region. So I want to mention before we get started, if you know of any data that is not available on the site, or if you know of any data that would be a good addition to the site, please let us know so we can work with you to get that data up on our site. We welcome conversations about more data to add. Of course, we want to make this as widely available as possible. So if there's data that you have, especially for the Appalachian region, please let us know. So to begin, so the homepage, this is the homepage when you come in, just some quick navigation things here. I have the pointer here, and then just so everybody can see it, here's my pointer where I'm at, up top left. You can print any page as you go through the site. You can PDF the page as you go through any portions of the site, and you can then copy a quick copy the URL wherever you are on the site right here in the top left. When you go to the top right, we have the ability to translate the site into a variety of languages, and then you can have a general search of the whole site up here in the top right as well. The Appalachian Children's Coalition logo, when you click on that, that takes you to the ACC website. And then when you click on this language here, it takes you to the homepage of this dashboard. Mostly throughout the dashboard, there are multiple links that are going to take you to the same place. So for example, we have build a custom dashboard over here, create a custom report, promising practices, and frequently asked question tabs. For the most part, we'll be able to link to these in other areas as well. So just so you know, there are a variety of ways to get to several spots in the site. So moving down, we have several drop-down menus here. We have a quick bulleted point list of how to get started, how to use this site, some advice on what's in here. And then we have our community dashboards, build a custom dashboard, disparity dashboards, and demographics. I'm going to focus, I'm going to go through all of this, but right now I just want to show you kind of navigation items, how we compare. We have the ability to look at data and compare ourselves to the Healthy People 2030 targets. Conduit also has developed several indexes that drill down to the zip code level, which is pretty interesting. The Health Equity Index, Mental Health Index, as well as Food Insecurity Index. I'll talk about those here in a moment as well. And then we also developed some specific county profiles and community maps for each of the counties. And as I mentioned earlier, we also have a regional a view. So we have regional profiles as well. But all this data we can get to again through our community dashboards and disparity dashboards, but we develop these for a quick view for individual counties and people to look directly at their own individual data. I'll take a look at those here in a moment as well. And then we have resources and funding. So for most of these, Conduit manages, we have promising practices, best practice models that have been published and found through published articles, journals, and those are updated and kept here under the Promising Practices tab. There are also funding opportunities that are listed here as well and that are updated regularly. Again, these are managed by Conduit, and so they're not necessarily regional focused funding opportunities, but more or less just general funding opportunities that are out there for any agency to kind of look at, and it's organized by content area, so it's pretty easy to take a look at. The resource library, as well as there are some resources that we ourselves put up here that you can find, but then Conduit also has additional resources that you can take a look at. For those folks who want more information about how to go through a community health needs assessment, steps into that. There's also a really nice step-by-step guide in here that you can follow to help kind of build out any needs assessments. And then there's a create a custom report section that I'll also go through. And then lastly, about ACC, this will take you to the ACC website, and then this will take you to the Behavioral Health Workforce Hub website that ACC that runs. So the homepage that you see here, just a little quick blurb of what the site is, what the purpose is. Again, you can find data here. There are search bars kind of all over the place, up at the top right, here in the middle. Again, everything is mostly clickable, but on this front page, and we plan to update these indicators every so often to keep it, refreshed, up to date, highlighting a different topic every now and then. But what you see here is an indicator, health primary care provider access, the actual data, the indicator, the rate, and then we have icons here that show us how we compare to the state, prior value, trend, and as you see here, this data is specifically for the Appalachian Ohio region. And moving down further, we have children living below poverty, same thing, rate, indicators. And so what's interesting is you can go in, like I mentioned, mostly this is clickable. You can go in here if you want to learn more about this specific indicator, children living below poverty. Let's take a look at this specifically here, and I'll go through this this indicator. So here what we have is this specific indicator, what we're looking at, what region, Appalachia, Ohio. This drop down, of course, we can open that up and go to the state, and then we get down to county, census place. It can be drilled down quite, it can be drilled down pretty close to the local level, depending on the indicator. Measurement period, and then we have a description of the indicator right here. Every once in a while, just let everybody know where the cursor is, why this is important. Again, this is our regional group data, so the Appalachian Ohio, our comparisons to Ohio counties, U.S. counties, and again, if you hover over, it gives some information about the data, about the comparison. The source is going to tell you the source of the data. That will take you right to that American Community Survey website, the source there, when it was last updated, and who it's maintained by. So Conduent maintains this specific indicator. Further, if we come down here, well, actually, let's see here. One thing I want to note, when you see people like this, you can click on the people and it will give you the demographic details about this location. So if we clicked on this icon here of the three folks, the three people, it would take us to the demographic page for Appalachian, Ohio. Again, there are links all over the site that will take you back to the same pages, and there are a variety of ways to get back to one particular location. So within these indicators, there's a lot more information, right? There's some charts, and whenever you see these three lines here, you can click on them and you can download the chart as a JPEG, as a PDF, or even into an Excel document. Each indicator is able to be downloaded, so you could get that data directly in an Excel format if you so choose. One thing I did not mention yet, there is the ability to see the legend on the left side, and this is going to give you information on color coding, what the icons mean, whether or not they're significant. And then again, you can even go to more info here, and this will take you to Conduent's help page. And Conduent's help page is also accessible down here on the bottom right. You can click on help and you can actually type in questions, and that will help you answer some of your questions moving through the site. Here is also another area to download the data to an Excel format. And as you see here, you have the ability, right now we're looking at the regional data. We can look at the state level, by county, census place, zip code, or even census tract for this particular indicator. And when you go down further in the specific individual indicator page, there's some really good information on related content. So what other indicators you might want to consider if you are looking at, say, children living below poverty. What are some promising practices related to this indicator, this content area? Are there any fact sheets related to that? Funding opportunities and so forth. So there is a lot of information included when you click on the individual indicator page. It'll give you source. It'll give you the ability to download the data, to download the charts as pictures or PDFs. And then, like I mentioned earlier, if you wanted to share this particular page with someone, you could easily copy that URL and then save that URL and send it to folks, and it'll send them right to this indicator page. Let's go back to the home page, and then moving down, we also have the mapping capabilities for all the indicators as well. This one particularly is looking at mental health provider rate. And here you can select any of the counties, any of the 32 counties. For comparison, let's take a look at, let's just go ahead and look at Ross. Kind of like up top, we have the rate here, it gives you the rate. And then we have all of our comparison icons here. And if you hover over, it'll give you some information about those icons and those comparisons. You can learn more. If you click on learn more, this is going to take us to that individual indicator page that we were just on, but it'll be on the mental health provider rate will be that indicator. What's more is that when we're in any maps within the site, we have the ability to add labels. So we can put labels on the counties. We can change the background of the map to nothing here. And then as well, we can also make the map larger or smaller depending on our needs. So let's move forward now to some of the information in here. So like I mentioned, we can go right here to community dashboard. And again, I just want to remind everyone that the help section is here to the right, bottom right. So if there are any, when you're navigating the site, if something does come up where you're not quite sure how to use or what to find, you can always check in the Conduit's help page. And again, there are plenty of ways to look for data. You can do a keyword search here. You can find a specific indicator here, or you can even search by location here. But looking here, we have the demographics dashboard, disparities dashboard, indicator list by location. Look at all the data. Like I mentioned, we have the ability to look at Healthy People 2030 progress and goals towards our progress towards those goals. And then again, we can access the social needs index suite from here as well. All of these can be accessed up here as well. Really, I just want to emphasize that you can get to a lot of these pages in a variety of ways. If we go to indicator list by location first, this would give us an idea of all of the indicators that we have on this site and at what level the data is available. So again, you can download this right into an Excel document, and it'll give you all of the indicators and then at what geographic level that data, that specific indicator is available. Again, you can click on that individual indicator, and that will take you to that individual indicator data page that gives you all that source information, reference information, year of data, last time it was updated, and so forth. We go back to the community dashboard. Let's take a look at the demographics dashboard. Again, here is another way to access the Help Center. Conduit is really good about making sure that the frequently asked questions and everything like that is all listed out and pretty thorough in their Help Center. So again, want to plug that. But here, you take a look at the demographics. You can then sort by location, state, region, county, and for some of the data, right, we can get down to zip code. Across the top, we have all of these different areas of demographics that we can take a look at, or we can just scroll down and look at the data here for the state. If you want to see a comparison, let's take a look at Ross County. So what's really neat about this is that when we choose an individual county, it'll show Ross's demographic information, but then it'll show also the Appalachian region as well as the state, just for a little bit of comparison, just to give a view of kind of what's going on there. And again, these three lines here, you can download the chart as a picture or a PDF. Most everything on this site is downloadable, savable, save as a PDF, download into an Excel document for your own use. Let's see. So I think that's pretty clear. We can move on to some more of the dashboards here, and so we can get to demographics, right? It just gives us a view of kind of what our demographics look like for the region. But when we go to the disparities dashboard, this will show us some indicators that we can break out the data by certain things like race, ethnicity, age, gender, to kind of look at what's going on with some of these disparities in the region. So let's take a look at Gallia County here for the disparities dashboard. And as a reminder, you can just take a look at the legend over here, just to remind you of what all of the icons mean. And then there's obviously a spot here to turn the colorblind mode on if needed. And then there also is a way to change the view of the data. And as you see, the data is just organized by content here, by topic, health, alcohol, and drug use, and so forth, health and cancer. You can also change the view to a card view. Let me see here. Oh, it's being a little slow, I guess. Here we go. So it displays the same information, just shows you in a different format. And again, these cards, these individual cards can be saved. You can learn more about the indicator itself. And when you save the card, it essentially just takes an image of this whole card here completely, and then that will just download, and you'll have that as a picture. But as you see here, you can go through all of this and it will give you all the disparities and comparisons through each one of these indicators or icons, I'm sorry. And then we can go even further. So we can build a custom dashboard. And then this is where I think the most use of this website will be found. Again, a quick little introduction on what this is, but essentially this is just a way to search for specific locations, topics, and that those items. One thing I do want to mention with this, the more filters you use, the less likely something's going to pop up. You kind of want to start off general and then go from there. What I mean by that is, say, let's just start off with a location. We'll go with Gallia County. And I'm really interested in children's health today. And as you see here, we have some advanced search options, which is really informational. We can order the search by the most recently revised indicator, comparison, and then as well as the value of the indicators, whether or not they're going up or going down in positive or negative directions. But let's just go ahead and search here. We'll keep it alphabetically arranged, and we'll search for Gallia and look for data related to children's health. And so as we see here, again, here is the card view, colorblind view, and then there also now is a link here to save this page, to save this URL. So then you could share this specific page with anyone. So as we see here, we have county, Gallia, and then you notice here, this says App Children. This is one of the indicators that we added ourselves. And so that there is only one comparison, and it is to the state value. But this is just an example of some of the data that we've added ourselves, and it gives you the year of the data as well as the value. And then, like I mentioned, not every indicator is going to be able to be compared to all areas. And so that's why you see here, there's only one comparison, whereas others, there are Ohio counties, the Appalachian region, prior values and trends. We do plan on to add some more data with OMOS, and so we should be having some trend data with that for several years as well. Excuse me. And so what we can also do with this in here, so we have one search for Gallia. Let's take a look at, I think we want to compare, we want to take a look at a couple counties here. So I added Ross to that search. And so right now I have it organized by location, as you see here, group by location. We can change that and go group by indicator. So then we can be looking at both counties together. So, for example, Now we see anxiety for students with Medicaid. We have Gallia's rates along with Ross's rates right there. So we can see really quickly the difference between both of those rates for each of those counties. And you can do that for a variety of counties, a variety of areas. Again, you can save this link, and so that way, if you wanted to share these comparisons between these counties, you can share this link, and this exact page will come up. People will not have to do their own search. This will already be here for folks to take a look at. If we want to look at something a little bit different here, so let's take a look at the data that has been most recently revised and see what that shows us once we put that in.
Daniel.
Yes.
It's Elizabeth, sorry to interrupt. So one of the questions in this chat was, is there someplace on this site where they can look at the complete list of data sources?
The complete list?
I have that. We have that link, Daniel. Kara and I will put that in the chat.
Okay. Thank
you,
you.
Marshall.
Thank you. So back to this, and then we see here with the advanced search of most recently revised or added indicators, we see here the date this indicator was last updated. Not necessarily the date of the data, but the last time the indicators were updated, added to our site. That's an important note. As you see here, this data is actually from 2022-23 school year, but we added it last month when the data was available to us. So that is just one note for when you organize by recently revised indicators. So again, this is a way to essentially to just drill down and look at some specific data, some comparisons, right? And you can have multiple locations in this custom dashboard. And like I mentioned earlier, you can get to this custom dashboard advanced search in a variety of ways. We can get to it here, build a custom dashboard. We can get to it by going to the community dashboard site and then going to build a custom dashboard. So again, just as a reminder, there are just a lot of ways, a lot of links to get to the same spot. And then we also, what we did as well is we went in and we built specific profiles and maps for the counties and the region. Just for a quick view, just real quickly, I'll just take a look. Let's see. For Coshocton, just take a look real quickly. Just a brief kind of description of what this is, how to use it, what you're looking at. And then here, right, it goes with the county, and then all the value, and here is the data, the indicator actually that we're looking at. And so you can search for the indicators, and whatever indicator you choose here, it will be specific to Coshocton. And again, the legend is right here to the left to look at what all the icons are meaning. As you see here, we have a link to the Coshocton County demographics and then the location report builder. I will talk about this here in a moment, but it's another really useful aspect of our site. And then for some counties, we have also added some information, some data, some reporting that was done for the OES surveying, some school districts. Not all counties have this available, but some counties, when you go into your profile, you will have the ability to look at some of these reports related back to school district information. The maps, the county maps are similar to that map that I showed on the homepage. Where instead of having it by location, you can search by indicator here. And so again, this will only show for Gallia County. So if we wanted to look at average household size, it is going to show the data for Gallia County alone. And again, as a reminder, over here, you can add labels, take them off, change the background, and so forth. And so we built those just to give folks a quick look at their region. Next, Healthy People 2030 tracker. I'll just talk about this really quickly. I don't want to drag this on too much longer. But again, this is the same sort of setup as in the past. The indicators pop up. They show up by content area. You can click on the indicator to get more information on individual indicator information, right? The source, the date, much more information, related content. And then here is, again, a new icon showing our progress towards that Healthy People 2030 goals. As well, you can also click here to get more information about Healthy People 2030. Let's see, and then the Socio Needs Index Suite, really quickly, I'll take a look at this. Again, like I mentioned, these were developed by Conduit, Healthy Communities Institute. It gives a little information here. You can click here and it'll give you a real brief summary of what these indexes are, what it means, what they mean. And then you can, of course, click on this link down here and it's going to take you to a more in-depth description of what this is. And so with these, they'll drill down to zip code. And it takes a moment. This takes a moment to load. But what you're looking at is the mental health index. You can change that by clicking that drop-down arrow to any of the other two indexes. This gives a little description of what this is. The 0 is low, 100 to high, 1 is low, 5 to high, that information. And again, it just takes a moment to load, but you can go drill down by zip code. It'll highlight each area as you hover over, and it'll give you the specific value, the date of the value, and the zip code you're looking at. You can export this map directly. Again, you can add labels, you can change the way it looks. And then as you go down further, it's going to give you data in just a different format and show you all these values by zip code. And obviously you see they're ranked or compared to other ones, the other zip codes in the region. Again, the 3 lines, you can download that chart directly. You can download this data directly to a CSV file. And then we have data source information as well as some technical notes for the index. I'll change real quick. You can change from zip code to county. These indexes are at a county level as well as a zip code level. We can add the labels there if we like. But again, you can look at the county and zip code for any of these indexes. And then change as you see fit. And sometimes it just takes a second to load here. But again, you can pretty much change and personalize a lot of this, a lot of the displays as you go through the site. And then let's see, last thing I wanted to mention is I wanted to give a quick look at building a custom report. And so this is the location report builder. Again, you can get to this several different ways, through the homepage, through this dropdown. But essentially what this does is it allows you to build, for the most part, most usefulness of this will be to have quick one-pager data documents. It can be tricky with formatting when you have multiple pages. So if you do decide to use this location report builder, I do recommend trying to keep it to 1 page. And I'll give a quick demonstration of how you would go about building your own report. There are some quick bullet point directions here, but we can start off by selecting the location. Let's go with Gallia County. We'll start there. And then, so as you see here, we now have all these options here. We have the option to save, to add indicators, to add demographic data, to add the socio needs index suite data. You can add a map of the location, add a legend, that is the legend with all the indicator information and the color coding, text boxes, and then we have some horizontal and vertical line breaks. And so to start, we have these icons over here to the right that will allow us to edit. And then from here, we can edit as we see fit. Let's make this a header. Let's center it. And then we'll save that. And then let's say we want to put some demographic information about Gallia County. We are really just interested in the age of our population. And we are interested in education. Let's see. I think we'll go with educational attainment, the 25 and over population. And then, as you see here, these individual cards can be downloaded themselves. And then let's put a text block. So we can say, is focused on providing mental health access to our region. Just something to put. Let's make it center it. We can bold it. You know what? I think I kind of want it to be a little bigger, so we add it here. And then as we see that we have a text box now, it shows up right here. And then I would like to add one indicator that is related to mental health. Just a quick search. And then we'll go with mental health provider rate, and we can do chart over time, and then we can do a comparison. And then so we see here the mental health provider rate within Gallia County, and then we can then come and edit this to say mental health provider rate in Gallia County. It's pretty much, you can pretty much edit this to what fits your needs. But again, a lot of this is trial and error. The formatting can be tricky. So really my biggest set of advice when using this report builder is just try it several different ways, reshape it. You can click and drag to move things around. You know, if I want to put this over here, you know, move it. So again, it's a little tricky, can be a little tricky, but you do have the ability to kind of move things around so that they fit on your page. And what also, what I have done in the past is you can add a legend. Again, this just helps with just displaying what some of these things mean, right? And then we can put this over here. And then if we go up here, we have these buttons over here to preview. And this is essentially what it's going to look like on one page. And then if we go to save, you can download it as a PDF. And then it'll take a second. It'll take a second, and once that downloads, I will pull it up just to show everyone what that specifically looks like on the PDF. But like I mentioned, when using this tool, I highly recommend just playing around with it. Some of the things can be cut off, and so you just have to be really careful on your formatting. And when you're going past one page, it can get really tricky to ensure that everything is on one page and not bleeding into another. This is just taking a little longer than I thought, but I did create another one that we can take a look at really quickly. This was Gallia County, and I did educational attainment, population, age group, poor mental health days, and then I have the legend here. And so keeping it on one page, you can make it streamlined and look nice. So I highly recommend sticking with one page if you're utilizing this. And again, just to end here real quickly with my portion, you can access the same thing on the site in a variety of ways. And there's frequently asked questions. So if there are you do need help when you're on the site, Conduit has a lot of assistance that they offer, or at least in frequently asked questions. And I think that's pretty much all that I have for now. I know I did a lot of talking there. We have about 10 minutes. Yes.
Daniel, this is Marcia. We have a question in the chat about if you could go back. I don't know if you want to go back and demo it, but under Explore Data, when you're building a custom dashboard, how they would download that as a PDF.
Oh, yeah.
Just do a quick one and just show where the little 3 lines that you click on to download.
Right, of course. So just okay. Children's health. We'll just keep it basic here. We won't do any advanced search options. So for these, you can save this as a link, or you can PDF it up here on the left. You can PDF this whole site. As far as saving it as a PDF for all of these, I do not believe that is a possibility, but saving the individual indicators by the PDF is a possibility. Saving it as a URL is a possibility, and PDFing the whole site or this whole page is. But as far as
can you go down to one, just do one of the indicators and show you how you can. Yeah.
And so here
right
again, it's you can save the individual charts, tables as JPEG, PDF, or Excel. And then again, you can come up here to the top left and PDF the whole page as well. Does that?
Thank you. Yeah. Does that? Oh, yep. That's it. Thanks, Daniel.
You're welcome. I'll go ahead and leave the screen up. I mean, I'm open for questions now. One thing I do want to mention before I end, again, I want to reiterate, if anyone has any data that they think would be useful to add to this site that is not on here, please get in touch with us. And then if anyone has any interest in getting additional training or demonstrations, please let us know. We're willing to work with you, or if you know any others who would like to have further training or demonstration on this site, please reach out to us. We're more than willing to provide more of these to folks. We want this to be used as much as possible. So please do not hesitate to reach out with any questions that you have about using this site. And as well, and I haven't seen the chat, but if there's any ways that you are thinking of using this site now that we've gone through, please pop that into the chat again, just so we kind of have an idea of ways people are planning to use this, so we can then again tailor this site even further to the needs of everyone using it.
Yeah, do you want to we have a few minutes, open it up in case anybody wanted to unmute and like ask a question directly to Daniel. I think you should have a way maybe to raise your hand or something. I haven't done this in so long. Or just start talking. Be a free for all. Anybody have any questions? As I mentioned earlier, we have recorded this and we'll be putting it on the Appalachian Children Coalition webpage, the link to it. It will also live on our YouTube channel, which is Appalachian Children Coalition. You can find it using @appchildren. So see if there's any new questions in the meantime.
Yeah, question about the contact info for the demonstration to a group, and that would be, they should just email you, right, Daniel? Oh, you're on mute.
Sorry. Yes, go ahead and just send me an email, contact me. I did put my email in there. But if you did not get that, my email is on the AC, or it should be on the ACC site, I believe.
It is. I'll copy it and paste it again in the group. So that's Daniel. We, just to avoid confusion, we contract with him via his position at the Voinovich School with Ohio University. So his email is an Ohio University email, but he does work for us with us at the coalition.
Thank you, Elizabeth.
Uh-huh. Is there anything else? And
For everyone
last-
else that, yeah, for everyone else that attended, thank you, or that's still here. Thank you all so much for joining today. We really appreciate it. We hope the site's useful. We hope that everyone can use it. And again, please reach out for any questions or help us improve the site.
Yes, as Daniel said, I think he said it earlier, if you have ideas about data that could be, should be on the site, reach out to him, let him know, and he will do his best to get that information incorporated. So, all right, thanks, everybody. Have a great 4 minutes left of your lunch hour. And we'll have this up soon. I will also send an email link to the recording to every person who registered ahead of time for the webinar. So you'll have it directly too. So, thank you.
Thank you.